Chapter 6: Problems and Limits of Epidemiology Source. Introduction to Public Health by Mary-Jane Schneider. 5th edition Epidemiology is the cornerstone of public health. It helps us identify risk factors, test interventions, and shape prevention strategies. But like all sciences, epidemiology has limitations. In this video, we'll explore the common challenges researchers face when studying human populations. You'll learn about study design problems, sources of error like bias and confounding, and the ethical dilemmas that come with clinical trials. Let's begin by understanding why studying humans is both powerful and complicated. The challenge of studying humans: epidemiologists study real people, not lab animals. That's an advantage, but also a challenge. Let's say researchers want to test whether a low-fat diet prevents heart disease. In a randomized controlled trial, they'd assign half the participants to follow a low-fat diet and the other half to stick with their usual eating habits. But unlike lab rats, humans don't always follow instructions. People in the low-fat group might cheat or drop out. People in the control group might start eating healthier on their own. These behaviors can blur results. Cohort studies offer another approach. Researchers track people over time and observe who gets sick. But people who have already chosen healthier lifestyles may differ in other important ways, like smoking or exercise, that also influence health. This makes it difficult to isolate the effect of diet alone. In case control studies, participants are asked to recall past exposures. But memories fade, and people may underreport or overreport what they ate or did, especially if they think it's linked to their illness. Each study type has strengths, but none are perfect. Sources of error. There are 3 common sources of error in epidemiologic research. 1. Random variation. Sometimes results occur by chance. This is especially likely in small studies. The larger the study, the more confidence we can have in the findings. 2. Confounding variables. These are outside factors that are related to both the exposure and the outcome. In a 1980 study, coffee drinking was linked to pancreatic cancer until researchers realized that many coffee drinkers were also smokers. Smoking, not coffee, was likely the cause. Another example: a study once claimed that infants who slept with the light on were more likely to develop nearsightedness. But follow-up research revealed a confounder. Myopic parents were more likely to leave lights on and also more likely to pass on the condition genetically. Bias. Bias is systematic error. It can creep in through or selection bias when study participants differ in ways that influence outcomes, or recall bias when people remember exposures differently. For example, mothers of children with birth defects may search harder for explanations than mothers of healthy children who lost to follow up. Especially in long cohort studies, people who drop out may be sicker or less healthy, skewing results. What makes results more trustworthy? Despite these challenges, there are ways to strengthen conclusions: a strong association, a clear dose-response relationship, a biological explanation that supports the finding, a large study population, consistent results across multiple independent studies. Together, these build a case for causation, even when true experiments aren't possible. A closer look at controversial studies. Let's look at some real-world examples. In the 1990s, hormone replacement therapy was widely prescribed to postmenopausal women. Cohort studies suggested it reduced heart disease and fractures. But in 2002, a randomized clinical trial, the Women's Health Initiative, found that HRT actually increased risks of heart attack, strokes, and breast cancer. So what happened? Selection bias. Women who chose HRT in observational studies were healthier to begin with. The clinical trial, which randomized participants, avoided that bias and provided a more reliable result. Ethics in epidemiology. Not all studies are just about numbers, they're about people. A dark chapter in US history is the Tuskegee Syphilis Study, where hundreds of black men were studied without their knowledge or consent. Even after penicillin became the standard treatment, they were denied therapy, causing avoidable harm. This unethical study didn't end until 1972. That scandal led to stronger rules for human research. Informed consent is now mandatory. All studies involving human subjects must be approved by an institutional review board to ensure safety, fairness, and transparency. Clinical trials must be halted early if harms or benefits become too clear to ignore. Conflicts of interest in clinical trials. When millions of dollars are at stake, science can be distorted. Consider Vioxx, a pain medication once promoted for its safety. Merck's clinical trials showed fewer digestive side effects, but also revealed an increased risk of heart attacks. That data was downplayed. Later lawsuits revealed that some adverse events were left out of published reports. This wasn't an isolated case. Research funded by drug companies is more likely to produce favorable results than studies funded by independent sources. This is a conflict of interest. To prevent this, clinical trials must now be registered on clinicaltrials.gov before they begin. That way, negative findings can't just be buried. Conclusion epidemiology isn't perfect, but it's essential. The science of studying human populations is messy. Bias, confounding, and ethical dilemmas are real. But when well designed studies are repeated and supported by biological evidence, they lead to safer treatments, better policies, and lives saved. As you move forward in public health, remember, it's not just about the findings, it's about how the research is done, who is impacted, and how we uphold trust in science. Call to action. This video is based on Chapter 6 of Introduction to Public Health by Mary-Jane Schneider, 5th edition, published by Jones and Bartlett Learning. If this helped clarify the limits and responsibilities of epidemiology, share it with others. And in the comments, what do you think is the biggest challenge in studying human health ethically and accurately?